It's frightening enough, really, between us that we see insurance industries in all realms, from fire to health insurance, really taking a bite at what we're doing. You know, it's kind of frightening here as seniors here in Oakmont to not know where it's all going to go. Well, today we have Dr. McDevitt, and Dr. McDevitt is a native of Philadelphia. She attended the Medical College of Pennsylvania, now part of Drexel University. She finished her medical training at Mount Zion Hospital in San Francisco. She spent 12 years in private practice in internal medicine and pulmonary disease, after which she became medical director of San Jose Medical Center. In 1995, she accepted the position of medical director of Marin General Hospital, where she led the effort for hospital to be a designated trauma center. She also served 4 years on the medical board of California. She's retired in 2009, has been a resident of Sonoma since 2006, and we would really like to welcome you, Dr. Mary McDevitt. Thanks for coming to Symposium. Is it on your belt here? Yeah. Oh, I'm sorry.
Okay, the green light. Can you hear me? Thank you. Well, first of all, I'd like to thank everyone for the invitation to be here, and also thank you all for coming to this presentation, given the beautiful, beautiful day we have outside with all our flowers blooming and everything like that. Before I go through my slides, I want to tell you how I became interested in this subject. As you just heard, I'm from Philadelphia, and through some of the information that I monitor in healthcare, I learned in 2019 that Hahnemann University Hospital was going to be closed. Now, this is a major hospital in downtown Philadelphia, has 500 beds. It's a teaching hospital, has over 500 residents in trauma, neurosurgery, medicine that rotate through that hospital for their training. And it was bought in 2018 by a for-profit equity company, and in less than 2 years, it was bankrupt and had to be closed. So that's how I got interested in the subject, because it was very close to my origins in Philadelphia. So I'm going to go through the presentation now. Okay, the first thing I wanted to tell you about is how these companies work for private equity. And as you see here, some of the outstanding features, they usually buy these companies, for instance, the hospital in Philadelphia, which is financed with a lot of debt. They have some investors, and then they borrow this money. And as soon as they get the property or whatever the organization it is, they transfer all that debt onto the entity that they have just purchased. They claim that they get very fast returns for their investors, 3 to 7 years. And they also charge these, what most people would consider exorbitant fees to the purchase entity. And as you can see up here on the slide, this is their reported return for their investors. Now, what's happened in healthcare and other organizations, there's usually layoffs. The price of the product usually goes up. And they do then, even if they cannot be successful, they have certain advantages if the entity goes into bankruptcy, called strategic bankruptcy. And there you can see the money that is spent in taking over these healthcare entities recently. Now, where do they concentrate? Usually in areas that involve our less fortunate population. They're very involved in prisons. They take over the phones, healthcare, food, all these services that are provided in prisons. They're very interested in nursing homes. This is two of the companies, the names of the two companies that specialize in nursing homes. They're also involved in mobile park homes. Blackstone is one of the largest areas in companies in that area. You can see they have 6,000 units down in San Diego that they own. They're into rentals. Blackstone also is involved with rentals of UC, our student housing, and I'm going to talk more about that a little later. They have gotten into medical specialties, especially emergency medicine, emergency rooms and the doctors that staff them, and I'm going to tell you a little bit more about that. They're into home health. This is the company that, private equity that's now involved in home health. And then the one I found most recently is that they're getting involved in owning methadone clinics. So I don't think there's any area of healthcare that they're not trying to get into. Now, these are some of the big companies. You might have heard of some of them. Carlisle, its big purchase was of Manor Care nursing homes, and I'm going to give you some details about that particular purchase. Blackstone is concentrating on team health, which is, their purpose is to buy doctor practices. And they also do specialize in rental units. They own 300,000 rental units across the United States, 9,000 of which are in California. Another big venture capital company is KKR. They have this Envision Healthcare, and they have bought up a lot of emergency medicine practices of physicians. We have the Highfield Capital Management. I just put in here because they took over Harry and David's and it went bankrupt. And that happens quite often when private equity takes over some of these companies. Brookfield Properties is important here in Sonoma because this venture capitalist company had bought and is the present owner of our Fairmont Sonoma Mission Inn. Okay, here's a story of Manor Care, which was a company that had over 200 facilities for managed care. That was bought in 2007 by the Carlisle venture capitalist company for $6.1 billion. And they had borrowed this 4.8 million of it. And as soon as they made the purchase, that debt then was applied to all 200 facilities. The manager of each Manor Care nursing home had to have that as part of their monthly expense. So the Carlisle investors only put up $1.3 billion for this purchase. I have trouble talking about billions because it just seems so out of rate to me for all these purchases of billions of dollars. Okay, the next thing that Carlisle did was sell all the real estate that was associated with these 200 facilities. So now if you were the manager of one of these facilities, you had to pay rent for the property that your nursing home was on, even though previously you had owned that property. They also charge these transaction fees. This is by 2010. This is what the group had to pay in millions of dollars in transaction fees and advisory fees. So what happens? First of all, if you're running one of these nursing homes, you now have a new boss, which is the Carlisle company. They would come in and look over especially your payroll and say, now I'm making this up, I don't know what the truth is, but say they find and they come and they say, well, you know, the state regulations say that we must have 2 RNs for every unit in this nursing home. We notice that you have 4 RNs on duty at this nursing home. You have to get rid of those RNs. We are only going to support what the minimum is. So as a result, in this particular medical instance, RNs are laid off, nursing assistants, LVNs take their place because they're less expensive. Now, this happened over, this is rather long, this is almost 10 years. But by 2010, with all these changes and restrictions and extra payments that they had to make to Carlisle, they were $7 billion in debt after almost 10 years of Carlisle management, and it went into bankruptcy. And that was the end of Manor Care nursing homes. Okay, there's a few things that I had to learn about, so I want to share that with you. This is terminology that is used in private equity firms. This sale leaseback I just told you about, they buy a property and then they'll sell the real estate and just keep the business. So now the business has to pay rent for the property that the business is on. And obviously, they can still sell the real estate in the future. In fact, with the situation with Hahnemann Hospital in downtown Philadelphia, it was suggested that one of the investors for Carlisle was a very major real estate entity in Philadelphia. And the reason they were involved, they eventually wanted to tear down the hospital and put up condos there that would be more beneficial to the people who owned the Carlisle group. Okay, also this carried interest loophole, and I'm not a tax person, but just to give you an idea that with all this compensation for services, they would be taxed only at 20%. And if they were paying wages like to RNs and other people in healthcare, their tax rate would be 37%. So they were getting tax benefits too as a private equity company. Now, you might be familiar, a year or so ago, there was the Inflation Reduction Act, and apparently they tried to correct some of these deficits and problems with the financial restrictions going into private equity, but they were unsuccessful and couldn't get the correction into that act. Now, a couple other terms, this dividend recapitalization. And this is how they would raise more money, say for Carlisle, instead of having dividends or based on earnings that a company was making. This dividend recapitalization allowed them to raise money to pay a special dividend to their investors. And it is part of law that they can do this. And then the bankruptcy process to me was very interesting. There is a provision under the bankruptcy law that's called 363 sale. And by this provision, a company can be auctioned off free of all prior debts. And it removes the discretion of the bankruptcy court. Once somebody asks to have a sale or an auction under this 363, new rules come in that certainly favor private equity. The other thing is you'll find that the private equity firm, once their product goes into bankruptcy, they can auction it off and sell it to another of their subsidiaries. So it just keeps going round and round. The other thing that really saves the money under this way of doing bankruptcy is that the company, the private equity company, will not be responsible for pensions if there is a pension plan within the company they buy, and that they then shift the responsibility for the pensions for the workers of that company to the Pension Benefit Guaranty Corporation. And I think this is like an insurance company for any companies that offer pensions in case they're not able to give the pensions. So back in 2015, Harvard did a study and found that 50 companies had been put into bankruptcy after being taken over by a private equity firm, and that they had transferred $1.5 billion of required pensions into this pension insurance company. So they really get off the hook. Okay, here's the story about housing at UC here in California. As I said, Blackstone has this real estate investment trust called BRIT, and they bought into 69% of this American campus communities, and that is the largest student housing company in the United States. They do own these apartments at both UC Berkeley and UC Irvine here in California. And the UC workers have no power over what investments decisions are made regarding their pension funds at UC. And some of the people involved in the pension funds decided that an investment in Blackstone would be a good investment. So when Blackstone had these units at UC Berkeley and Irving through their 69% control of American campus communities, they were then charging these fees, and it went up to $1.5 billion in management and performance fees. Now, the students in these areas were already having trouble finding places to live or to rent to live as they were going to the university. And there were reports that even some students were living in their cars because they could not afford the rental fees of these apartments. So the students and other faculty members got together, and I think this was a couple years ago, and they were protesting, and they asked UC to divest their pension funds of this money. And the UC response was, this investment is good for our pension fund. Our main concern is the pensions that we promise to UC employees. So as far as I know, nothing has changed there. The UC pension fund is still invested in Blackstone. Now, recently, and I would say over the last couple years, these companies are looking at doctor practices and saying, hey, I think this is going to be a moneymaker for us. There are three main ones involved with doctor practices. KKR Envision is one, KKR being the private equity firm. Blackstone has a division called Team Health, which is primarily buying doctor practices. And they Envision, who specialized in the emergency room doctor practices, uh, has a lot of debt. They're running the company into debt again. And they claim they were losing money to their investors because of the No Surprises Act that was passed, which essentially says if you have an emergency and you go to an emergency room and your insurance considers that out of network, they can't send you the bill because it's an emergency. So this company was claiming we're not making as much money as we would like because this No Surprise Act is preventing us from collecting from the individual as getting services out at a place that's out of network. Now, luckily, the emergency room doctors have gotten together under the American Association of Emergency Medicine, and they are suing Envision. And the basis for their suit is that in California and 22, I think, other states, corporations are not allowed to practice medicine. So it really has to be run by the physicians. And of course, what happens with some of these doctors, I had a friend that was involved in a clinic that was run, and she was a rheumatologist. And she would join this group. And after a couple weeks, she got a knock on the door. The non-physician manager of the practice had to talk to her because she was taking too long with the patients. They had her on a schedule, 2 patients every 15 minutes, because that's how they were going to make their profit. So it's really a significant problem. And as you can see, the physician group is suing Envision, and they're not asking for money. They just want the state of California to live up to our present law that says corporations cannot practice medicine. So that is going to trial, I think, in San Francisco sometime this year, maybe at the end of the summer. So we're all hoping that they'll be very successful with that. Okay, now, recently, because of all these problems that are happening, our US Senate is finally getting involved. And as you can see there, right now, 40% of the emergency rooms are owned or staffed by private equity firms. I already mentioned KKK and Blackstone, and the third biggest private equity firm is called Apollo. And 40 ER physicians went to the Senate committee, and I think it was maybe just about 2 weeks ago, and they were testifying to the lack of patient safety and inadequate care of the patients because of the requirements of the private equity firms as far as the time they spent with patients and other things that they demanded so they could save money. So one of the committees was the Homeland Security Committee, and it is presently evaluating the business practices of private equity firms that are involved in care in the emergency rooms in our country. And then the Senate Budget Committee is also involved because another problem is when all these hospitals get together in bigger and bigger chains, that they're saying this is very possibly antitrust. Because once hospitals get into a big group and they take over the healthcare in a community where people have to maybe drive 2 hours to another hospital, essentially they have control over the pricing of services there. So that's another thing they're looking at, which needs correction. Okay, now, where do private equity firms get their money? Well, the main source is pension film. And as I told you, UC has investment up into the billions of dollars in that Blackstone private equity firms. And the reason that this is happening is there's a lot of pro-business people in our government. Just mentioned a few people here, Eugene Scalia, secretary, when he was Secretary of Labor, Jay Clayton, who's chairman of the SEC, and they passed some laws that even insulate these private equity firms from lawsuits. You're not allowed to sue them. So certainly that's beneficial to them. And then in 2020, the Department of Labor expanded and said, okay, now you can access 401k funds. Apparently, when our retirement funds were set up, there were regulations that they couldn't be invested in potentially funds that were risky, that they might lose money. But as of 2020 now, they can invest in your 401k funds. So might be well to take stock of those and see what those funds are investing in on behalf of you. Okay, they're also going into insurance companies and banking, but the term private equity has been in the press a lot. I don't know if you've seen it. They have decided that is bad press and they have to drop that term. So they are now calling themselves, as you see here on the slide, they are now alternative asset managers. So watch out for that term. Okay, now here's some of the things that have made it easier for private equity to do what they do. There's been a relaxation of antitrust laws. And apparently there's a lot of discussion in the courts and even at the Supreme Court about what is tacit collusion among different healthcare companies. And it's been going back and forth. And some of the things that have come up recently, if people are talking about their prices in text messages, do text message statement of your prices to your competitor can justify tacit collusion. So their discussion. Another one is if they have not arrhythmias, but algorithms to determine prices. The fact that they're using an algorithm, is that tacit collusion among these companies to price fix? And then in 2004, you can see Justice Scalia said, monopoly is an important element of the free market system. So they saying this is okay. But even worse than that is the next one, because apparently when companies wanted to get together, they said, oh, the purpose of getting together is efficiencies. And that was denied as a reason by law. You couldn't get together as a big conglomerate just because of efficiencies. Well, that's been changed now. And the FTC merger guidelines say efficiencies are a primary benefit of mergers. So that has been overturned. Now, the other thing that's a problem is because these companies are so big, if somebody tries to stop them and litigate, they have more money and more lawyers to fight against any lawsuits than any doctor group could have. So it's really a problem. Now, the one thing that is good, I wanted to try and bring some good things to them. The Federal Trade Commission has been looking into mergers of hospitals in one area so that there is no competition. You might have 4 hospitals now where they were independent, now they're part of a big conglomerate. So they can price fix because people can't go anywhere else. So the Federal Trade Commission has challenged 4 large hospital mergers over the last 4 to 5 years, and they've been successful in stopping them. So that's a good thing. Okay, the other thing I think that supports private equity firms is the fact that all these people here, if you'll recognize some of the names, after they leave the federal government in their role as Treasury Secretary, Speaker of the House, CIA Director, Secretary of Defense, I'm sure you recognize some of these names, they all go into these private equity firms and they become members of the board, and mainly because they get a lot of money, a lot of a lot of dollars for participating there. So this is a major problem that needs to be addressed. Okay, I want to, if you want to learn more about this issue, this is the book where I got a lot of my information. I think it was published about 2 years ago. And this Brendan Ballou, who is a graduate of the Law School of Stanford, but he also worked as an investigator in the private equity division of our Department of Justice. And so he has a lot more details here in the book. It's a very readable book. I love the picture there, the private equity plan to pillage America. And I think that sort of says it all. So with that, I'll end my presentation and entertain any questions if I can answer them, or I'll hopefully refer you somewhere where you can get the answers. So thank you very much for your attention.
We'll be passing around the mic. I do want to let you know that this is being filmed, and if you go to our website at oakmontsymposium.org, this will probably be up and running in the next few days, and you'll be able to capture not only the presentation, but the question and answer period also. So,
We do have a question back here.
you got a question over there, Lynn? Okay.
What motivates the sellers? Why does Manor Care, for example, they seem to be doing fine. Why did they sell?
Manor Care, because they were paid $6 billion to sell out. That was the motivation.
Good questions here. How does this affect the, there's like a company in between your insurer and the hospital that negotiates the rate you're going to pay, negotiates what the hospitals are going to charge you. Is
Mhm.
that also included in this private equity?
No,
thing?
that's a little different. And in fact, I've just been reading about this recently. In fact, I'm going to talk to the administrator of Sonoma Valley Hospital because I was at a meeting last night and this lady came up to me And she said, "Are you Dr. Yeah, I didn't know her. I don't know where she's coming from. So she apparently went to Sonoma Valley Hospital. She's a member of Kaiser, woke up with severe abdominal pain in the middle of the night and had to, the nearest hospital was our hospital. I think she was there 4 hours. They did some kind of a scan. They gave her some morphine for pain, and then she went home and subsequently was admitted to Kaiser and had her gallbladder removed, and she did fine. They sent her a bill from our hospital for $43,000. Now, can you imagine? There is, I think, a Kaiser Healthcare Foundation has a news um, publication that I follow. If any of you are interested, you know, the Kaiser Foundation is independent of Kaiser. So you can sort of believe what they say. You know, they're not an organ for the Kaiser Health Plan. Um, but she is going to send me her bill. And when I see it, I'm going to talk to the administrator of Sonoma Valley Hospital. But I explained to her that Kaiser probably has a contract with Sonoma Valley Hospital because they know some of their members may not be able in an emergency to get to a Kaiser facility. And all those contracts are individual and they're kind of not made public, but certainly our hospital or Kaiser would not pay that amount of money to our hospital for that care. And so every medical advantage program that you may be in besides Kaiser that are local, I think there's 8 offered medical advantage programs in our area. When you look up Medicare Advantage programs, you have to put in your zip code. And then they'll tell you which ones. I think Kaiser has 2 different programs. There's about 3 or 4 other companies that offer a Medicare Advantage. Well, each of those programs has to go to the hospital and develop a contract with the hospital. And you might have seen in the news that Aetna Blue Cross Blue Shield contract with Sonoma Valley Hospital. They were trying to negotiate a new contract. It wasn't working out. And they were going to stop their association so that people that had that Medicare Advantage program with Aetna Blue Cross Blue Shield, if they hadn't finally resolved it, the members of that program would no longer be able to go to Sonoma Valley Hospital because it would be considered out of network. So anyway, when I get this bill, I'm going to go meet with the administrator of our hospital and just see what the story is. But I asked the lady that told me about it, I said, could you find out from the Kaiser end, what is the Kaiser contract with Sonoma Valley Medical Hospital and see what now I don't know if she'd be able to get it, but she's a member, so she's going to ask, and she's going to ask anyway. The other thing that you may be aware of, if you've seen in the news, our federal government and CMS, which is Medicare, funds Medicare, has required hospitals now to publish their fees so that you can go to a hospital and say, okay, how much do you charge for an MRI? Now, you know, if they do have that, you know that may not be what your health plan is charged because they're all individual contracts. But a lot of the public is saying we should know what our hospital is charging for its services. So there's been a lot of movement at the national level to see that they start fulfilling these requirements. When it first came out a couple years ago, I used to work for Sutter Health when I was the medical director of Marin General because they had the management contract then. And Sutter Health did comply with this requirements, and you could go into their database, and it would tell you how much the hospital services were. But a lot of the other hospitals just ignored it, and I think CMS, the federal government, is going to, work on that to try and get more transparency for what the charges at the hospital are. Yes.
I just want to remind the audience that for those of you who were here a couple of weeks ago, when Dr. Victoria Sweet talked about slow medicine, she talked about the private equity firm Multiplan, which is owned by the Carlyle Group.
Yeah.
And Multiplan has contracted with many health insurance programs, including Kaiser, to be an intermediary. And Multiplan tells the insurance, um, the providers, the doctors, the hospitals, how much they should charge for out-of-network and in-network reimbursement.
Mhm.
So you may get hit with a huge medical bill, and Multiplan gets $1 billion in profit per year by telling insurance companies, oh, you don't have to reimburse that much.
That's right. They're the ones that are deciding. I've just recently been seeing articles about that, and it's something I'm probably going to add to my presentation eventually. But the other thing that you might have heard about is pharmacy benefit managers that advise these insurance companies what they should put in tier one of their Part D plan. You know, there's 4 or 5 tiers of what you pay for your medicine, depending on what plans you're in. And so they're looking at that, and they're getting a lot of support from independent pharmacies, because there's a fear with all these multi-plan and also taking over these pharmacy chains, that the independent pharmacist is no longer going to be among us. It's all going to be chains and private equity firms that run this and say how much you'll have to pay your insurance companies, and so forth and so on. The other thing that may have read in the news is that Medicare just released their reimbursement for Medicare Advantage plans. And I think you all know that Kaiser is a type of a Medicare Advantage plan, right? Okay. And for the next year, they're increasing their reimbursement only 3%. And of course, all the Medicare Advantage plans are upset about that because, oh, we're going to lose money, and they're not losing money. Their profit is in the billions of dollars. So there's a lot of things going on and change, but this multi-plan, I'm going to keep an eye on that and see what happens with that.
I want to go back to the first question. You mentioned the Hahnemann Hospital down in Philadelphia.
Yes.
How was it that they chose to be sold?
Well, they were not doing that well financially. They had been owned previously by Tenant. See, all these companies come in and say, well, we can find efficiencies that will make you financially solvent. And they even were owned by a while by a nonprofit company. And the gentleman who bought them had a lot of experience in healthcare and turning hospitals around and making them, viable as far as financially. But when he came in, he couldn't make it better. And all his improvements were reducing staff and so forth and so on, that really drove it into bankruptcy, because previously the hospital had owned the ground that they were on. And when the company sold the real estate, so that whoever bought it eventually would have that real estate to tear down the hospital and put up the condos. That's what was written up in the paper about it anyway. So that's where it is.
Are you aware of any hospitals or medical groups who have successfully resisted attempts by the private equity firms to buy them out?
I don't know. The first sort of legal action against them, I think, is the emergency room doctors trying to, not get money from them, but to say, look, California, we have a law that says you can't have the corporate practice of medicine. Please, support that. The other thing is they have so much money. The other approach that some of the doctors are taking, if they're in a group like that and they complain about quality of care, they find out that they are fired. Okay? And a lot of these companies have non-compete laws, so that if you're fired, you have already agreed you won't start another practice within so many miles. Well, that's another issue that's being looked at. These non-compete laws, a lot of states are doing away with them because it's preventing doctors from setting up practice. So that's another thing to watch. The other option that these doctors have, if they're fired, they can then sue for inappropriate dismissal. And so I'm watching a couple of those cases, because if they can get money from these firms for inappropriate dismissal or cancellation, that might be another avenue to try and change the practice. But I think what really has to happen is the federal government has to look into this and say, stop, you cannot do this anymore, and that's the Federal Trade Commission and Department of Justice and some other federal organizations have to address this program and get it solved.
First of all, thank you very much for your presentation. But then secondly, I wanted to ask you if you have any general comments about the Advantage plans that get affiliated with Medicare. We found out that when my husband was involved in healthcare, switched plans and went to Aetna, we found out by trying to make an appointment that we were now in an Advantage plan, which we did not know we were in.
In fact, I just read an article about that some brokers are changing people without their knowledge into a different Medicare Advantage program. It sounds like that's what happened to you and your husband. Medicare Advantage plans, what you'll read about, the big problem with them is what we call upcoding. Medicare Advantage plans are paid a monthly capitation fee to take care of you, okay? So that was the basis. And I think in Sonoma, the last time I looked for 2024, it was something like they get $1,200 a month to take care of you in a Medicare Advantage plan. Now that they get it, whether they don't see you for a year, whether you have 10 visits, whatever services you need. The problem is that wasn't enough money for them. So there was a regulation, I can't remember what year this came in, several years ago, that these companies say, oh, but our patients are sicker. That isn't enough to take care of Mr. Smith because he's been in the hospital 3 times in the last 6 months. So what they did was call a risk management process, where if certain diagnoses are associated with the patient, either for a service or be hospitalized, Medicare will pay them more money. And so that is a major problem. And there is a group, I belong to, Physicians for a National Health Program. And we have been fighting and trying to get our congresspeople to look into this to see that this is stopped. But Medicare has got to stop it. And so far, they haven't been interested in saying you can't do this anymore. In fact, they are all upset because they're only going to get a 3% increase in their capitated fee next year from Medicare. But it's a real ripoff. And the problem with it, some people have predicted that if this continues, it's ripping off the Medicare trust, and that in 10 years, there'll be no money there for our children and our grandchildren to be able to have Medicare when they come of age. So it's a real problem. Does that answer your question? Thank you.
I wanted to ask about Kaiser is a nonprofit, and then there's, I guess, privately owned
Okay,
hospitals.
here's the story of Kaiser. There's 3 parts to Kaiser. The first is their insurance company. Okay, that offers you your insurance through Kaiser. That is nonprofit. Then they have another company, I think they include all their hospitals and clinic. I don't know what they call it, but it's nonprofit. The third part of Kaiser is Permanente. You all know what Permanente is. It's the doctors, the doctor group. They are for profit. And if you look up, first of all, when I write up all the profits, you have to say net income for Kaiser, but it's in the billions of dollars. They, at one point, I guess still have so much money, about a year or so ago, there is a company called Permanente Ventures, and you have to look this up. This group of Kaiser and the Kaiser docs is investing, they have enough money to invest in 60 other healthcare companies. So that's what they're doing. And of course, they'll get profit from those companies if they're successful in making a widget or some kind of healthcare device. So it's both nonprofit and profit, if you think about the three parts. And I tell everybody, I think Kaiser's ability to provide coordinated care is fantastic. I mean, I know a lot of doctors that work for Kaiser and they like it because they don't have to take care of all the administrative stuff that you would have to take care of if you were in private practice. Okay, we have some.
Yes. So one of the things I wanted to point out is there's a book called Wealth Supremacy. Oh, there's a book called Wealth Supremacy that people might be interested in. And it also talks about private equity and some of these same things. And I've been following this for a little while. So it's very interesting talk that you're giving today, and a lot of really great information that I think we need to have. Because more and more the private equity is taking over whole sectors of
is.
our economy.
Could I ask you the name? I didn't get the first word of the name of the book. I'm not familiar with it.
Wealth,
Yeah.
wealth as in
Yeah, wealth. Okay.
supremacy.
Wealth supremacy. Who wrote that?
You
Do
know, I'm trying to remember the name of the woman who wrote it, and it's
Yeah,
not in my
okay.
brain at the moment, but
Now
It's fairly
the
new.
title is coming back, but I have to look it up. But
Ye-
anyway, thank you.
yeah, I
Thank you
think
for
it was
mentioning.
published last year, maybe.
Okay,
And the wealth supremacy is also getting into the publishing industry,
yeah,
which
Yeah.
could be a problem with there you've got
Mhm.
like multi-billionaires controlling what
Yeah.
gets published and what doesn't.
Well, the reason that they like healthcare is CMS or Medicare pays these advantage programs $400 billion a year. These are all of them, not just Kaiser, all over the nation. And private equity looks at that and says, hey, we need to get some of that money. So let's get involved. Yes,
Thank you for your presentation.
you're welcome.
Are you part of some kind of a professional or grassroots organization that's trying to fight these, or are you aware of any organization? I do know about private equities taking over local newspapers.
Mhm,
60 Minute did a segment on them several years ago that basically they bought up all of the local newspapers and destroyed them.
mhm.
And because of that, a lot of places in the country have
Right.
absolutely no independent local
Mhm,
news source.
mhm,
And so they are kind of like a real threat.
mhm.
And I'm wondering, is there anybody that is organizing to do something?
Yeah,
Because to tell you the truth, I do not trust our politicians to do
Yeah.
anything about it on either side of the aisle.
surprise, surprise.
Surprise, surprise.
Um,
Thank you so much.
Yeah, as I said, I belong to a group called Physicians for a National Health Program. And we have a Sonoma Napa chapter, which I was chair of for a while. And we coordinate with Healthy California Now, which is another organization. We have joint meetings. So Healthy California Now is one that you could look at. The other thing is there is a group called One Payer State. And I would advise you to look on their website. There are, I think, 22 states that are trying to develop a program for the state for one payer. And certainly we in California are trying to do that. I don't know if you're familiar with the CalCare bill that's now in the, it's going to be considered in the Health Committee of the Assembly this next week. And essentially, it is a single payer program for the state of California. This is the second time it's been put through. It's been run by the California Nurses Association. They're trying to get it. And there have been multiple attempts over the years to get single payer in California. But I was on a one payer state Zoom yesterday, and they were saying that the progressive Democrats in Congress have come up with their program for 2025, what they're going to be working on. Single payer healthcare is not in it. And the reason they were saying is because President Biden doesn't think that's the way to go. So, yeah, so I think it's going to happen at the state level. And well, in Canada, when they did it, it was in one province first, and then it spread. So I think we're going to have to do that. But I don't have a good feel that this bill is going to pass in California, but we got to start trying. But look up one payer state. It'll give you a lot of information about what's going on at the different state levels to try and get single payer.
Yeah, you just answered some of my question.
Oh, did you?
I'm right here.
Yeah, I see you now.
You raised a lot of sobering facts and information. I was just wondering what we as the public can do. As I said, you just answered some of it, but is there anything else we could do to combat that?
Yes, there is something you can do. Right now, Representative Khanna from San Jose, have you heard about him? Okay, he has a bill going through Congress that would make it easier for states to implement a single payer program. And right now, I don't know what committee that's coming out of. But if that could be passed, it would be easier. First of all, let me tell you what you need to know about a single payer for the state of California. Right now, the federal government supplies to California money, federal dollars, for every California that's on Medicare. Okay? It also supplies some money for every Californian that's on Medi-Cal. And it also supplies money for Californians that are on the Affordable Care Act that got their insurance, because it was noted that people just didn't have the money. They couldn't get Medi-Cal because they made too much, but they didn't have enough to pay these premiums. So the federal government subsidizes their membership on the Affordable Care Act insurance plan. Okay, so to make it work in California, we would have to get waivers from the federal government so that all the Medicare dollars, all the Medi-Cal dollars, and all the Affordable Care Act subsidy dollars from the federal government would be sent to a trust in California to pay for health care. And then whatever was left over in the cost would come out of California's money, which would probably be a tax. But I don't know if you remember, a couple years ago, Governor Newsom started the Healthcare Commission that worked for, I think, 2 years with meetings trying to figure out the finances of this. And they came out that their final recommendation that if we had a single payer healthcare system in the state of California, over 10 years, we would save billions and billions of dollars. Yeah.
Dr. McDevitt, thanks for coming back to Oakmont. You've come and talked to the Progressives Club a couple
Yes,
times about
yeah.
single payer.
Thank you.
We recently had a visit with our primary care physician that lasted somewhere between 12 and 15 minutes. And I read that under these new ownership structures, primary care physicians can have between 2,000 and 2,500 patients. Is that accurate?
I can't comment with any knowledge of that, but I don't think any company could say you have to have that many patients. I mean, that's ridiculous. What they're focusing on is the time that you spend with each patient. They figure it can be more effective with less time, which is not the way medicine works. I don't know If you go to your doctor, it might be 10 minutes, it might be 20 minutes. If somebody comes in that has, severe emotional problems, you might be spending an hour with them. And you have to have the leeway to spend the time that is required with the patients. The other thing that's most concerning to me, I've seen surveys that physicians are really upset with what's going on in medicine. And as a result of COVID and what's happening with our healthcare, a lot of physicians have retired, even not at retirement age. And the thing that is even worse than that, there was a survey of physicians who said they're not advising their children to go into medicine because it's not a profession anymore when you have payers and companies telling you how to practice medicine. So a lot of doctors are really unhappy with what's going on now. And, I think there's going to be a shortage of doctors in the future if we don't get this fixed. So,
Okay.
yes.
uh, I was a physician who retired over 20 years ago at age. Okay.
You can hear it now.
I hate public speaking, but my father wanted me to be a lawyer and I decided to be a doctor.
Yay.
Yay. And I worked at a place called Sonoma Developmental Center
Oh, right. Okay.
and I saw patient abuse and I spoke out and I got 9 nails in my tires. And I felt that a society is judged by how it takes care of the most vulnerable in
That's true.
its society.
Yeah.
I stayed as long as I could. There were 3 of us physicians. One physician wrote notes in the chart that went missing documenting patient abuse.
Mm.
His notes took off. He photographed them. They fired him.
Mhm.
He sued the state of California, and just like venture capital, the state of California is a deep pocket.
Mhm.
And it took 10 years, but he won $1.3 million, which really didn't make up for the loss
Yeah,
of
for the
his
loss of
career.
his profession.
And
Yeah.
basically, I left medicine. I was so disillusioned with how things were run at Sonoma Developmental Center. And I spoke with Daniel Ellsberg, and I got his book from 2007, Secrets. And I said, Daniel, I too lost my profession.
Mm.
And he wrote in the frontispiece of Secrets, which was published 2007, to Carol, thank you for your courageous truth-telling. I have not done much in medicine, but I would really like to join you in your cause.
Okay, we'd be happy. Anybody who is associated with healthcare, you don't have to be a doctor or a nurse or even interested. You can, join our Sonoma Napa chapter of Physicians for a National Health Program. So what I'm going to do is leave some cards with Judy. And if you're interested and would like to come to our meetings are usually 11 o'clock on the 3rd Saturday for an hour. And so if you want to get involved, we'd love to have you.
Any other questions? Mary, thank you so much for such a
Well,
dynamic
thank
presentation.
you all for being a great audience. I really appreciate it.
Our neighbor for Sonoma, it's good to see you. We'd like to welcome you back again. And we hope to see you next Sunday